Hello, Namaste, Adab. Today we are privileged to have Dr. Sweta Agarwal with us, and she's the director of the Department of Obstetrics, Gynecology and Infertility at the Southern Gen Hospital. Hello, Doctor.
Hello, I'm Dr. Sweta Agarwal from Southern Gen Hospital. So, my main area of interest is infertility, and we operate from two centers. One is in Basheerbagh and one is in Banjara Hills. And for any appointments, they can directly contact our clinic on the number 8096 41 440. So my staff can help
Yes.
anyone for appointments on this number 8096 41 440. So
And Doctor, I wanted to know what is the meaning of infertility from the doctor's point of view? Because we know what is not fertile, that is infertile.
Yeah.
But from the doctor's point of view, what is the meaning? How do you define infertility?
So when a couple has been trying to get pregnant in the reproductive early years, if they've been trying for a pregnancy for about 1 year, so for 12 months without using any contraception or without avoiding a chance to get pregnant, and they are trying actively for a pregnancy for 12 months. Despite that, at the end of 12 months, if they are not pregnant, then we say that it's infertility.
Okay.
From a medical point of view.
And what are the points that we need to infertility? Is it the lifestyle nowadays? Like we find women and men smoking, drinking, and they have a sedentary lifestyle. Then lot of some may take weeds and all that. Drugs.
Sure.
So, what is the reason for this infertility?
There are a number of reasons why there can be infertility. One of the major reasons is lifestyle changes. And infertility, is a disease of a young couples, young women, people will be trying for pregnancy. And so lifestyle changes is a really important factor, and the rise in infertility is because of that. Definitely smoking has a negative impact either on the male or the female fertility. So does alcohol and use of any of these recreational drugs like weed and all. With sedentary lifestyle and the changing way of living, like working in MNCs, the husband and wife working in opposite shifts, they are not getting enough time for each other. These are some of the reasons, the way, and also we women, compared to the past, we have more and more career-oriented women, whether it's you, me, or anyone else. We all would like to work. And so because of that, sometimes we put our work in front of starting a family. So that's also a very, very important reason. And this is a very important message which I want to get it across to everyone. Is people think that we will plan a child later on, let us settle in life first on and find a good job. But at some point, we have to understand that the age is a very, very important factor from a female point of view for fertility. So with the age, as the age of the woman advances, the fertility is reducing. Especially after 30, there is a drop in fertility. After 35, there is a very big drop. And after 40, we are kind of entering into our menopausal years. So the ideal time to have the first baby is before 35. Ideally before 30, but at least before 35, because after 35, there's a big drop. The number of eggs and the quality of the eggs drop down. Yes, there are women who will get pregnant even after 35 or even in their 40s. But majority of the women, the chances as the age advances, the number of eggs and the quality of the egg is going to drop down. So it's very important that we bear in mind that point for all of us, that we need to plan earlier. Yes, career is important, but we need to take a little bit time out from there and complete the family, because that's equally important. And later on, we see a lot of patients coming to us, they don't realize that age was an important factor.
And what is the starting age of pregnancy?
That can be from any age, like of course after marriage, after 21, when legally they are made people can plan anytime after they are married. They can have a baby.
Previously, girls used to get married at
Exactly. Our grandmothers and mothers, they married at an early age, at a young age of 16 or 18. So they used to start a family by 19, 20 or much younger than that age. So we didn't see so much of infertility. But now, because all of us are working women and we are a little bit more focused on the work, and which is not wrong because we don't know the importance of age. If I could get that message across to the viewers that we should plan early, it's that will be really of much benefit to everyone.
And I mean, is it essential for a woman to be a biological mother? I mean, they can adopt children.
That's the choice of the women. Women of today are independent. They make their own choices. We get a lot of some couples who feel that they don't want to have children and they would like to adopt children later on in life when they are ready for it. That's absolutely fine as long as they are okay with that. We get couples where women do not want to go for egg donation and they would like to have their own genetically related children, or even men who are wanting to have genetically related children. So we have that group of patients and we help them with that, with the different treatments which we have. So if they want to have biologically their children and they're not able to get pregnant naturally, we do help them and assist them with the fertility treatments. But it's not essential that you should have a child which is biologically related to you. You can go for adoption. It's just the choice of the couple and they need to understand and they need to come to terms with that choice. That's all.
Yes, because nowadays it is the choice of the women also.
Yeah.
Like they can say no to anybody who approach them, and also no to motherhood.
It's absolutely. We are living in an era of women empowerment, and so I leave it to the choice of the women. Even when the women come to us, if any of the family members have a desire, but if she is not ready for it, we don't get into those treatments until she is okay with it. So that's her choice. It's her body.
But sometimes the society can be very harsh on that couple, and psychologically it can be stressful if there is infertility or the woman isn't ready for.
That's absolutely right what you're saying. But because we are in a cultural society, the culture of the place plays a very important role. So in the Western world, the cultures are different. Our cultures are from time immemorial. We always have a feeling that a family or a marriage is complete or successful when they have a child. But that's the way the parents might be thinking. But if the husband and wife are comfortable with this thought of going through fertility treatment or going for adoption, then it's absolutely fine. They have to give a deaf ear to what the society or the other family members are saying. So as long as they are not worried about it, yes, infertility is not very easy to handle sometimes. It's going to give it's a toil on it's physically and mentally, emotionally, financially, in every way. It's a very draining situation. So we quite often offer in our clinic also psychological support. We have counselors at the clinic who will be helping the couples to help them to go through this tough journey with their support and help. So it's never wrong to ask for any kind of psychological help, or it can sometimes have an impact on the relationship of the couple as well. So as any kind of psychological help or relationship counseling, any of this, if needed, they should be open about it and they should approach to us as doctors, and we can guide them. So definitely, it's not very easy to handle such situations, and whenever there is need of any help, we are always there for our patients.
Tell me about the treatment, doctor.
Okay. When we talk about the treatments for fertility, the problem can be either in the male factor, male, or it can be in the female, or in both. So 30% of the sign we see that's a male factor, 30% of the time it's the females, and 30% of the time it's both in the male and the female. So when the couple comes to the clinic first, we evaluate them. We do a simple basic tests for the female and the male. The male needs very simple a semen analysis to check for the sperm count, the movement of the sperm, and the quality of the sperm. And for the wife, we do an ultrasound and a few basic blood tests to generally assess her health. So once we kind of know where the problem is, it's with the male, female, or either, both of them. Once we know that, then we can talk about the different modalities of treatment. So with the different modalities of treatment, the first one is timed intercourse, timed relationship. So what we do is we advise the couple to come for scans and see when the follicle is ready and when the egg is about to rupture. We advise them to have relationship together. So quite often in a busy couples where both of them are working, they may not even find the right time to get together. So just simple treatments like timing your intercourse when the husband and wife should be together with this simple follicular study is what we say is a follicular study where we do scans for the wife to see the follicle growing, which actually carries a good egg. And when the follicle ruptures, that's when the ovulation happens. And on the days of the ovulation, we advise the husband and wife to be together. So that's the best time where it is a maximum chances of getting pregnant. So this is a first step to treatment. And in a busy life, I have seen that a lot of couples, they just need that kind of a simple advice of the ovulation days and the right time to do. So that's the one first step of treatment. Then other treatments like we do IUI, it's intrauterine insemination. That's the next level of treatment in which again what we do is do follicular scans for the patient to see the follicle growing. And once the follicle is good size, about 20-22 millimeter size, we give them an injection for the egg release. So the follicle will rupture and a nice egg comes into the fallopian tube of the woman. And at that time, on the day when we demonstrate that the ovulation has happened, that day the husband gives a semen sample in the lab with some special ways of preparation. We prepare the sperm where we remove the dead sperm, the sperm which are not motile, and just we take good quality sperm from that semen sample, and that good sperm with a very fine catheter, we put it inside the uterus around the time of ovulation. So in the place where it actually has to be there, the sperm sample is placed. That really gives a good chance for the couple to get pregnant. And so quite often, there is a reasonably good chance with this modality of treatment, particularly when the husband's sperm count is a little bit on the lower side, or the movement of the sperm is not so good. In those situations, or if the woman is not ovulating very well, like PCOD patients we see, quite often doing ovulation induction, which means helping in the egg development, and IUI, where we prepare the sperm and put it inside the uterus. These two treatments gives a reasonably good chance of getting pregnant for them. And then if this treatment also doesn't work for some patients, then we go for IVF or in vitro fertilization treatments, or in the normal language, the test tube baby is what people understand. So that's another way of treatment. There used to be a lot of social taboos and all, but people are now more aware, and more number of patients are coming forward for these kind of treatments. They are also IVF. Also, they are very simple treatments. They are not very complicated. Very simple outpatient-based procedures where there no need of overnight stay in the hospital. So usually we put the women on certain injections for egg development, which they take it from the second day of period for 8 to 10 days. and we monitor the growth of the follicles with ultrasound. When the follicles are ready, we plan for the ovum pickup, egg pickup procedure. The egg pickup procedure is also a very simple procedure which is done under light sedation, IV sedation in the operation theatre. We do it, and the patient is discharged same day home in the evening, and it's there's no cuts on the tummy or anything. It's done transvaginally, and it's a very simple, straightforward procedure. She's mobile, she'll get up and go home in the evening, and she's absolutely fine. And then we take the husband's sperm, wash it, and collect some good sperms out of that. And in every egg, we put a sperm and develop these embryos in our lab in the incubator. So the incubator, the temperature and the atmosphere inside the temperature is as if like that of a mother's womb. So the embryos, they grow and then we culture them in the dishes, creating like a womb-like atmosphere there, and develop the embryos. And whichever embryos are looking good, these embryos are placed back into the womb of the lady. And then she is given some medications for 2 weeks, and then we do a pregnancy test to confirm that she is pregnant. So they can have a biologically or a genetically related child through these different ways of treatment, either trying with naturally with intercourse, timing your intercourse, or with IUI or IVF, with any of these modalities of treatment. We make the embryos and put it back into the womb of the lady, and then we call her 2 weeks later to check that if she is pregnant. So with all these modalities, we have a reasonably good chance of having a child which is genetically related to them, despite a lot of underlying infertility related issues.
This is so very interesting. So, right after getting pregnant, all through the 9 months, does the woman have to take rest, enough rest for, because she is undergoing this treatment, or like a normal?
It's like a normal pregnancy, yeah. There's a wrong notion among people that once they conceive through IVF, they have to have a complete bed rest throughout 9 months. It's nothing like that. They can be like a normal pregnancy. Of course, they can have other problems of related to pregnancy later on. They may not. So it's absolutely fine. It's like a normal pregnancy. Usually, we need to be a little bit more careful for the first 3 months of pregnancy. That's the first trimester. But as the pregnancy goes forward, things usually become more settled. It's just they are conceived after a long time. The patients are very anxious and they want to be extra careful. But medically, it's like a normal pregnancy. It's just we are assisting or helping them. That's it.
With normal exercise.
Normal food, normal life. We encourage our patients to go back to normal life within the first 1 month of conception. Gradually, we encourage them because they need to feel normal. 9 months is a long time. So
can they have a normal relation with the husband during this?
Usually, we try to avoid it for at least first 3 months. And then later on, if everything is good, there's nothing wrong.
Yes. So how do the woman or the couple, they prepare themselves for this treatment?
The first step is to come for a consultation with us. Then we assess the couple. They go through a few tests. The wife will go through some blood tests and ultrasound. We need to do a test to check if her fallopian tubes are open or blocked. We do a test to check the patency of the tubes. And then for the husband, we do a semen analysis to check the sperm count and motility and all. So once we know these reports, based on this, the treatment plan is recommended, and then they can go ahead. Plus, we put the women on folic acid, calcium, and vitamin D supplements. Is also important, and also if they are having any lifestyle, some kind of habits like smoking or alcohol or any kind of recreational drugs, they have to stop. They have to stop that. If they have underlying hypertension or diabetes, that's not a contraindication. Just they need to be under control. The blood pressure, the hypertension can be controlled with the oral medications. So being on oral medication for hypertension is under control, she's absolutely fine to get pregnant. And same goes with diabetes or even thyroid. So these conditions are quite common. So hypertension, diabetes or thyroid, we need to be on medication, and as long as the condition is under control, it's absolutely fine for them to go ahead with the treatment plan. So we explain to the couple what they are going to go through, what to expect, the time frame, everything. We give all the detailed information, and then once they are ready, we go ahead with the treatment, because these are very simple treatment. It doesn't affect the work or anything. Our working couples, they can do these treatments without interrupting with their work as well. So it's
And
absolutely
does
fine.
this treatment lead to twins?
There is a good chance of having, you see, even in a natural conception, there is a 5 to 10% chance of having a twin pregnancy. It's slightly higher, about 15 to 20%. Especially when we do IVF, we want to put back more than one embryo. If we put back one embryo, the chance of having single pregnancy is high. But of course, if we put back two embryos, the chance of getting pregnant is also higher. Either of the two embryo can implant. So if we put back two embryos, there is a chance of a single or a twin. So about 15 to 20% is the chance of twin pregnancy with IVF treatments.
And is the treatment very expensive? Can they be covered by insurance?
See, treatment as such, it is little on the higher side, but it's not affordable or beyond the reach of the people. A lot of patients come forward for these treatments, and it's reasonably okay. It's not that expensive that somebody cannot afford it. And when we talk about insurance, we do have EMI facility in our unit. So where we can help them with EMI for the IVF treatments. So roughly around 1.5 to 2 lakhs is the range what a patient will end up spending with IVF, which I think is nowadays not a very big amount for anybody to arrange 1,50,000 to 2 lakhs amount is what is needed. So, or otherwise, if they find it difficult, we do it through EMIs through the bank.
And how does it feel when the children are born and they grow up and they come to you?
I mean, it's a really, it's so satisfying. I guess the entire area of obstetrics and gynecology is like that. We in our hospital we have treatment. We help them getting pregnant with IVF, and we also do a lot of fertility centers don't do the deliveries. They send it to the other centers. But we do deliveries for our own patients. We have obstetricians who take care. So we take them through the entire, pregnancy, and we deliver them. And also, if they post-delivery, in case if the baby is born premature or any kind of help the baby needs after delivery, we've got very good neonatologists and pediatricians. So we have a complete package from before pregnancy to post-delivery to take care of the baby, which is not there in most of the centers. So that's another advantage of coming to us, that we understand the pain of the pregnancy, and they are as precious for the patient as they are for us. So we really, and it's really satisfying. I am the patients come back. Some of the patients, they celebrate the first birthdays of the babies in our hospital. They arrange lunch or something for our staff and celebrate. That's really nice, that even after 1 year of having the baby, they are coming back and remembering us, and they feel that this is a more important and a place to visit and celebrate their birthdays. Is really sometimes quite touching for us. And patients who have traveled back to their hometowns, if at all they are visiting Hyderabad, they can make it a point to come back and meet us. So all of this, gives a lot of happiness, that it's not just about the treatment process and everything. The connection which we hold on for n number of years post baby is born also, makes us feel very happy.
So nice.
So it's really nice to be in this field. I feel it's just not giving the pregnancy, giving a live baby in the hands of the couple is more satisfying than just a positive pregnancy test is what I feel. I feel the success of IVF is when the patient goes back home with the baby rather than a positive pregnancy test.
Yes, absolutely. Doctor, tell me about the embryo preservation and the sperm bank.
Yeah, we do have the sperm and embryo banking done in our center, which is essential in any fertility center. So what we do is, if the woman gets extra number of embryos, so we put back one or two embryos into her womb, and if we get more than that, we freeze them and keep it in the embryo cryopreservation is what we call. So freezing of embryos is legal and it's their property. The patient can come back and use it again. So for their second child, it is preserved for them, and we do have the embryos are frozen in fine straws and we store them in liquid nitrogen tanks. And then the quality of the embryo is as good as what we have frozen today. Same goes with the sperm as well. We can freeze the sperm for the husband or the man and keep it, and whenever they want, they can use this sperm for getting pregnant. Especially sperm freezing, like men are lucky, they don't get the sperm quality is not affected until late 50s, until they are into their 50s, 60s year of age. So by then the woman would have completed the family. Sometimes the male may not have sperm. They may be azoospermic, which means there is no sperm in the semen. So we do certain simple surgeries like testicular sperm extraction or epididymal sperm extraction or testicular biopsy. These procedures can be done on the testis where the production of the sperm actually happens, and we collect sperm from there. So when we get sperm from there, we can freeze it so that we don't put the man under the knife again and again. So we can freeze such sperm, or sometimes nowadays with an increasing incidence of cancer world, if a male has diagnosed or a female is diagnosed with cancer and they're going for cancer treatments, in that case we can freeze their eggs or the sperm. They can go through the cancer treatment and come back later on with us to have babies. So we had recently, a patient from Maharashtra. The husband was diagnosed with cancer. He froze his sperm with us, went through the treatments for testicular cancer. After that, his sperm count was 0. And then we used this sperm for the wife to go through the IVF treatment, and they are now pregnant. She's now blessed with twin boys. So the technology has changed so much. It's just we need to understand what is there for us and what is more suitable for our situation and go ahead with those kind of treatments.
And does this treatment later on affect the woman's menstruation cycle or maybe menopause later on?
Not really, not at all. These are very, very simple treatments. They do not have any side effects on the major side effects on the health of the man or the women, or they do not have any great impact on the menstrual cycle. After the IVF, the woman lives a very normal life. No impact on her aging or her menopause. It has been there from the last 50 years, I said, and lots of studies have been shown that there is no increase in incidence of any major side effects following any of these fertility treatments.
I think the first test tube child's name is Durga.
Yeah, that was the first Indian test tube baby, and the first one worldwide is Louise Brown. She was born on 25th July, so that's celebrated as a World IVF Day, 1976. The first IVF baby, and then few months later we had Durga from Kolkata.
Yes.
So no, we have been really Indian. Indian doctors have been pioneers everywhere in the development of any kind of treatments, and India is now a medical hub. It's a hub for medical tourism, and the results we don't have to travel to US, UK or Australia. I have spent 7 years in Australia, and the kind of treatments which we offer are in par with Western standards. So we don't have to travel anywhere across the globe. It's right there in our own cities. Every city has an IVF center, and which are very well equipped, and we are doing excellent work and giving very good results. So people from across the world are coming to India for fertility treatments because they are more cost effective, and we are offering better treatment than what happens in other countries. So we should be proud about it and take advantage of being it in our own country.
Did you always wanted to be a doctor?
Yeah, from childhood I always wanted to be a doctor. I come from a doctor family background. My mother is a gynecologist and
In Hyderabad.
yeah, and my father is an ENT surgeon. So coming from a background of medical doctor's family, always had that impact and that a desire to become a doctor.
And then you went to Australia. Was it after your marriage?
Yeah, after marriage for further advanced training, particularly for infertility. And we do a lot of hysteroscopic surgeries also. Hysteroscopic surgery is when you put a camera inside the uterus and look at the uterus from inside, and if there are any problems in the uterus like fibroid or polyp or a septum in the uterus, we do treat them as well. So we do those treatments also. So I trained myself in the IVF treatments and the hysteroscopy and laparoscopic surgeries there. And it's almost 12 years since I spent 7 years in Australia. And since 12 years, we are back in India and doing well.
Thank you.
Yeah.
And we are blessed to
Thank
have you and Dr. Nitesh here.
Thank you. Thank you so much.
So we have come to the end of our session. So any message you want to give to our viewers?
One message, what I was telling about the impact of age on fertility is very important. And there are lots of myths around fertility treatment, which I think at the end of our session, you've clearly asked the right questions, and there is no fear about IVF. It's a very simple treatment, does not have any long-term impact with excellent, very good results. So I think people should come forward for fertility treatments and do not worry about it because they are very simple and we have all the possible treatments available in our country. So I would say just go for it if you really need to go for it. Yeah. Any kind of fertility.
So the need should be there, the requirement,
yeah.
not just go
for it. Yeah. So you get yourself assessed, and if you really need to go for any fertility treatments, you should do it earlier than later, because the age of the women is the most important factor, whether it's for a natural pregnancy or any fertility treatment. So success of any fertility treatments depends on the age of the female partner. The younger the woman, the higher the results of our treatment. So everything is the female age.
So many times we find elderly men, they like to marry young women because of this.
I don't know. You should ask them.
So how do you spend your free time?
Free time I like to spend with my family, with my children. Because during the day we are busy at work, don't get enough time with children. So I like to spend most of my time with my children or with my friends.
Thank you. Thank you so much, Doctor.
Thank you so much. It was really nice talking to you and nice to have you here. Thank you so much.
Thank you. Thank you.